A stent is a small mesh tube inserted into the esophagus to keep it open, allowing food to pass through. A crucial intervention for patients whose food passage has been narrowed or blocked due to cancer.
And though our eventual goal is to cure people and to prevent esophageal cancer after we find out the causes, and I'll review those very briefly, but the second reason that's quite important is because if someone does come with their esophagus blocked off, they can't even swallow. And so an endoscopy can be done, a tube can be put in called a stent, S-T-N-T, and after that's in, it changes the situation from at least not being able to swallow it all and having to carry a spit cup to being able to swallow liquids and soft foods.
At Kyabirwa Surgical Center, 50 cancer patients at an advanced stage are benefiting from free diagnosis and stent insertion. The Ugandan Embassy in Washington, African Esophageal Cancer Consortium, and global partners have made this possible.
When it comes to the Embassy and the Ministry of Foreign Affairs, it's important for us to find partnerships and frameworks in which stakeholders in the US can partner with Ugandans to be able to, one, find solutions for esophageal cancer patients in Uganda, which can be in the science, technology, and innovation area or sector, and this includes the stents, to be able to help reduce the price in which these patients can be able to attain these stents.
Founded in 2019, the Kyabirwa Surgical Center was founded to disapprove a long-standing misconception that surgery is either too complex or too expensive to be in rural communities. About 84% of Ugandans live in rural areas, and over 75% have to travel over 2 hours for essential surgical care.
The patients make a very small contribution. The highest the patient contributes is about 25% of total cost. Most of them are way below 10 or 15%. Matter of fact, a good number of patients that show up cannot even afford the little contribution we ask for, so we completely waive off. We try our best not to turn away every patient, although we want to encourage patients to own their health through that small contribution.
In addition to the stent procedures, a training session for local doctors and their assistants is underway, focusing on the treatment and early detection of esophageal cancer.
So we partnered with the Uganda Cancer Institute to help with the mobilization of identification of clinicians that could participate in this in this training workshop. And so in addition to that, not only just with the physician, but to identify patients.
The training is being conducted by Dr. David Fraser and Dr. Rahul Pannala, Emeritus Professors of Medicine, Mayo Clinic of Medicine, USA.